all the NASHA is very elastic, and you can see like this, really bouncing. For this one, it's totally different. So, and you can see here as well, it's like, so what we do then is to differentiate the OBT products. It's more about looking at the rheological properties. And if here we talk about the lifting capacity for NASHA, here we talk about the flexibility for OBT, what we call X-strain. So it's actually how much you can stretch the product. So we will start by the softest of the OBT products, Restylane Refine. And Restylane Refine, the softest of the OBT products. So you can pass around, and I can take this back. And so Restylane Refine is a product with very soft gel, very low G prime. So in comparison to Restylane Luft, very soft, very, very soft. And this means when you have a very soft product like this, when you inject the product, Restylane Refine, it will spread in the tissue. Restylane Lift, it goes like this, and you got this projection. For this one, you get a much bigger integration of the product, so it's spread when you inject. So, what is very interesting about the OBT technology is something that we can look at on the Restylane Kiss product. And the Restylane Kiss is, of course, indicated for the it's a little bit stronger than Restylane Refine, but still very soft. So we can pass around Restylane Kiss. So Restylane Kiss. And what is really interesting about the OBT technology, as I said, we have the X-strain flexibility. So if you look here, what you can do with the gel, it's like this. You have the gel, and then you can actually pull like this. So it's actually very flexible. And what the fantastic thing about the flexibility here is that if you treat a patient and you treat with maybe superficial treatment, or you treat a patient with thin skin, so what you don't want to happen is that when the patient is smiling, the implant becomes visualized in the skin. So what we did is that we performed a clinical trial that was called the expression study, and that one actually we did not look at only the effectiveness of the treatment, but actually we treat many patients and then we film the patients with a topographic camera, so that when they are injected they were told to make faces, to smile, and then we can film them and show that you have a natural appearance of the face even after the treatment. And the result of the treatment and the study is that the products were retaining the natural appearance, and the explanation is this then, that you do have a flexibility. So first, when the face is not moving, this is what is like, and then when you are moving, the face is smiling, the implant follows the tissue movement. And then you can maintain the natural appearance. So then, we come to the next of the, I have to get the garbage can for the next location. So, the next product I will show you is Restylane Refine. And Restylane Define is the strongest product of the OBT products. It has the same particle sizing as Restylane Lift, but it is much softer than Restylane Lift. But still, it does have enough to be a very good product for treatment of chin, for instance. So, I will pass this around as well. Restylane Define. And you know, maybe I should not talk about competitors here, but there is a big difference here, because this product is very, if you look at the G prime, the strength of the product, this one is almost exactly the same G prime as the Juvederm here. But actually, if you look at the flexibility, there is 4 times more flexibility in this product. So they are similar in G prime, but this is much more flexible, and it shows that you have these two measurements are important to know about. And have you seen the graph that we have on the products? You have to start with Restylane Lift, and then it goes over to Restylane Define. I think the graph is over at the medical book, and that's a really important tool to select the correct products. So, the last product I will show you is something that is a little bit, maybe not a secret, well actually, yes. So, if you look at then this product, Restylane Volume, that product is actually the same gel as Restylane Kiss. But the thing is that in Restylane Kiss, we use like this kind of filter to make the gel particles. But for Restylane Volume, we use this filter. So you can see it's a big difference here. And so, as a result, Restylane Volume, it contains very, very big gel particles, but still is easily injectable through a 27 gauge needle because of its softness. So we can feel the Restylane Volume. So, Restylane Volume. So, any volume? Okay. Yes.
Kiss.
So, yes.
Kiss
It's a
and
very, very
volume.
special product because it's well, as you can imagine, this is huge. This is like almost like a barbecue. So, any questions about anything about gels that you would like to know?
Would OBT like refine suitable for also tear trough?
Sorry?
For tear trough?
This one,
Yeah.
for tear trough, no, actually, we consider this is not as suitable. The Restylane iLight, we was decided that iLight was the best tear trough product because that we have because of the clinical experience, this product, which is actually the same as Restylane Classic, a big difference between these two is that the capacity to absorb liquid between these two is very different. So this one, maybe it can absorb maybe twice, 2 times its original volume in water, this one maybe 10 times.
So it swell less
And
for
usually
eyelids.
this, yeah, and I mean normally in most tissue it doesn't really matter because most of the tissue actually is very strong put together, so it doesn't really render to swell much. But in here there's a little bit of a different story, as I understand. I'm not a clinician, but from anatomists, and so they say, well, and in the morning, all of us can feel a little bit puffy under here. So definitely, if there is one space where you would like the product to stay in a certain size and don't expand, is the teardrop. And that is actually the reason we selected Restylane. Otherwise, I agree with you. You would imagine that for teardrop the softest would be the best, but in this case, actually, it's not. Because in the long run,
Highlight.
highlight, yes, highlight is the number one choice. Any other questions?
Can you repeat the difference between the highlight and also the classic Restylane?
Yeah, well,
in terms of the technology.
yeah, I mean, practically, the difference between highlight and classic is actually that in a way, it is actually a rebranding of 0.5 ml of this one. Yeah. But that is also supported by quite a large clinical study, or actually 2 clinical studies performed on the indication. So we have a US study, so we have approval for the indication in US and in Canada, and then it's getting approvals worldwide as well. But we need to apply for indications.
Same product but different indication.
Yeah, you could say, but also that we selected to use the 0.5 ml classic. Okay.
I know for forehead is off-label.
Sorry, forehead? Yeah, I can't discuss, but for off-label, please check with Global Medical Affairs for compliance.